I am super excited for today. I have been telling so many people about what I'm doing today. In fact, I was on the phone with some of our best friends that are non-dental this morning, and I'm telling them all about Uche. And I'm like, okay, you're going to listen to this. I'm going to post the link on Facebook for all my non-dental friends. So I am excited to introduce to all the dental drill bit listeners from all over the world. We have people from everywhere, Uche. So Dr. Uche Odiatu, okay? He is with me today, and I have been counting down the days and the hours for this opportunity. Yeah, I want to tell everybody a little bit about you here because I have this here. I'm going to read it. I printed it out. I want to read it. So Uche is a professional member of the American College of Sports Medicine, a practicing dentist in Toronto, and this busy healthcare professional is an NSCA certified personal trainer, certified yoga instructor, boot camp instructor, and this blows my mind. He's given 700 plus lectures in England, Canada, the US, the Bahamas, Denmark, Jamaica, Bermuda, and Norway. I mean, wow. He has been an invited guest in over 400 radio and TV shows from Alaska to Atlanta, from New York City to California. I mean, Uche, when I look at all this, you've done so much and so much for dentistry and for humanity. It blows my mind. And I just want to tell the listeners, don't stop. If you're driving to work, as so many people tell me, I listen to your podcast on my way to the office, you got to pick back up on it because you're going to want to listen to this entire presentation by Uche. So Uche, man, what do you have to share with us today?
Oh, it's endless. And it sounds like I've done a lot. I really feel I've only scratched the surface. Like, the iceberg, you described the tip of it. Like there's so much to me and you that people don't see. And I think I always believe people have a public life, a private life, and a secret life.
Yes.
That's my very public life. And I guess what makes some people very authentic when they communicate is I'm pretty much the same anywhere I go. You see me at 1 o'clock in the morning, I'm laying on a PEMF mat. It's pulse electromagnetic frequency mat, which lowers inflammation. If you see me first thing in the morning, I'm having coffee with reishi mushrooms in it to lower the acidity with my SAD light to wake up my brain. So I'm pretty consistent, but I love sharing these things, which I do so effortlessly with people who find it such a struggle. I love demystifying, slowing down aging. And if they really tap into what you and I are going to talk today, they can literally reverse age. People who are listening or watching could literally 5 years from now look and feel younger than they do today, which is like, it sounds like a miracle, but you can literally look and feel younger than you do today if you hack into, not necessarily the cliche biohacks, but just start treating your body a little differently. And the body is so adaptable. Any age, it's ready to be your best friend again.
I'm excited about this because so many people are looking for more energy, right? It's like everywhere I go, it's like, Cindy, I'm under a lot of stress and I need more energy. And I think all the things you're going to share is going to be helpful with that. And I want to shout out to our good friend, Henry Unjabendi, and his beautiful wife, Jenny. They're going to be listening. They're the non-dental people that's going to benefit from this. And I'm excited to share.
Okay. So I'm not sure you heard of the effect. It's called the Dunning-Kruger effect. So the Dunning-Kruger effect is the fact that the minute someone knows a little bit about something, they overestimate how much they know. Someone goes on a diet, they lose 5 pounds, and they start sharing with everyone on Facebook. And meanwhile, I'm not listening to you because you've lost that same 5 pounds 30 times, So while you and we've got so much bigger body of knowledge. The more I learn about nutrition, the more I learn about mitochondria, the more I realize I don't know. And it's actually very humbling to read 20 books on exercise. It's very humbling to get a postdoctorate certification in nutrition. It really shows you how much there is to know. And 80 years ago, eggs were bad. 90s fat were bad. Now I know eggs are completely fine. Intermittent fasting was really popular 3 years ago. Now the inside information about intermittent fasting is it's only good as an intervention. It's not meant for long term because anyone over 50 needs a certain amount of protein every 4 hours because over 50, if someone's not exercising, the body literally suffers entropy. It starts falling apart. People lose 1% of the muscle mass every year after 30 if they're not doing resistance training. And that happens even quicker if they're not eating throughout the day. And it takes some thought to eat every 4 hours. But we're talking like yogurt with some nuts in it. We're talking about a salad with feta cheese on it, maybe with a chicken breast on it. And this protein idea, people often, they go, I'm 60, why do I need protein? My son does, he's a bodybuilder. No, it's even more important over 60 because we don't digest and absorb protein the same way as we did with 20. It's very inefficient. So if someone's fasting, not eating all day because it's popular, and not eating all day because they heard someone talk about it, and they're only eating in a 6-hour window, for the other 10 hours they're awake, they're going to undergo what's called a negative nitrogen balance or slow diminishment of their muscle. So I know, sorry if I'm using a little bit of scientific words, but as people to know is intermittent fasting is a trendy topic, but it's only a short-term intervention. It's not meant for a long-term way to have a really good physique or a really good body.
Makes sense. The last time I heard you speak was the Academy of Dental Management Consultants, and I took home something that was so simple. And I think of you, and I mentioned this to you in the email, it's like several times a week because I'm cutting up the asparagus and I'm throwing in that spinach and arugula and shiitake mushrooms.
Oh.
Are those good?
If all we did was get people excited about mushrooms, it would be life-changing. Like our Archimedes, you got to leave it long enough. Mushrooms, I hated mushrooms the longest time, but I love learning new science. So about 5 years ago, read some information about ergothioneine. Ergothioneine, if they put that into Google, they could find it. Ergothioneine is an amino acid. They've known about it for 100 years. They're actually now thinking about calling it a vitamin. And the last vitamin was named in 1948, B12. So ergothioneine, this is what ergothioneine does. It's an amino acid. It purges free radicals and exhaust and breakdown products from bone marrow. Bone marrow is where the river of life is formed, red blood cells and white blood cells. Ergothioneine purges exhaust from our mitochondria. You and I can only blink 14,000 times a day, and our heart beats 86,000 times a day because we have mitochondria pumping out ATP. Well, ergothioneine purges exhaust. It cleans up our mitochondria. It cleans up the exhaust from our liver. Everything we eat goes through our liver. Every drug we have, every over-the-counter thing we have goes through our liver for the blood goes to the heart. So ergothioneine purges junk from the liver. Ergothioneine is in the most abundant in a natural form, which is in mushrooms. So
I'm excited.
Think about this. So that alone, people should stop the tape, go into a Whole Foods or go into an Albertsons, get themselves a bag of cremini. Don't overthink it. Cremini, white, king oyster, shiitake, reishi. Get yourself a pound of mushrooms and you use those 4 times a week. Cook them because there's less chance you'll have any kind of issues with natural mushrooms. Have a bit of a toxin inside. So cook them. You will give your cells what they want. And I tell people, you can hack into the wisdom of your body if you start giving your body what it wants. It needs fiber. It also needs to get rid of the exhaust. Think about it. If you put a cork in your exhaust pipe in your Lexus or in your Mercedes, how far would you get? Well, people who don't have any ergothioneine or don't eat mushrooms, or it's also in a thing called black beans or chicken livers. But if someone's not eating ergothioneine, which I think most people aren't, they are not getting rid of that exhaust and their bone marrow gets sluggish and full of sludge. Their liver is operating poorly and their mitochondria is not pumping out ATP. I mean, wonder why, sadly, I just don't have the energy I had as a teenager. You're not having ergothioneine. You're missing some vital nutrients, which will give you your youth back. And that's only one aspect of it. But ergothioneine alone is life-changing for anyone. And there's no patented mushrooms. Like you can literally use different ones all the time. The more variety, the better.
That's amazing. So we were taking that because I'd seen you on Facebook or Instagram where you put it with your eggs. So I started doing that. And that has been a game changer for me. So every morning we have that or something similar to that. And then we take it, maybe sometimes we'll do oatmeal with some fresh fruit, some berries. But when you eat those vegetables with those eggs, I mean, honestly, you're not hungry. I mean, that you have energy like crazy and you're not hungry. Yeah.
Mm-hmm. Well, you think about it, a lot of us have good intentions, right? Who doesn't want to be successful? Who doesn't want to be a good mother or a father? Who doesn't want to be a good mentor or speaker or consultant? However, a lot of us have great intentions, but the flesh is weak. We desire success, but the flesh is weak. You can have all the desire in the world to be a good communicator and not be triggered emotionally. But if someone's not sleeping well, which means they're not getting good REM sleep, rapid eye movement sleep, and it's during that rapid eye movement sleep, neuroscientists say we process emotion. So the minute someone's not getting a good 7 to 8 hours a night, they're not getting the 100 minutes a night, which sleep scientists say we need, they don't process emotion. So they drag the baggage, they drag unprocessed, stale beliefs from yesterday, from a lifetime into today. And now when they communicate with patients, they communicate with clients, their stories are fuzzy with old beliefs that no longer work, simply because they don't sleep enough. So forget the mushrooms. If someone is just sleeping poorly, They don't have good emotional clarity. They don't have good emotional processing. And we all know now intelligence is important, but I'd rather have my kids have emotional intelligence. Richard Branson talks about, he goes, I'm not that bright, but he says emotionally, he empowers everyone around him. He considers all 66,000 employees of his 300 companies in Virgin Group his friends. I know dentists with 30 team, and they brag about they don't even know their last names. I wouldn't even tell my worst enemy that I can't remember my staff names. Like, what? How boorish of you to brag you don't know your team's last names. Oh, I got 4 offices. I barely know my team. I would actually keep that a secret, dude. I would keep that a secret. You will not seem like an enlightened leader in Necker Island. You talk to some, the Bezos and the Mosques and the Naveens of the world with Richard Branson, and that dentist brags about not knowing her team members' last names. You will not be invited back.
Right, exactly. That's crazy. Yeah, that's just good people skills. So what should people be eating besides mushrooms and veggies?
Okay. Whole foods. People always talk about the supplements. Anytime you process something, it's less bioavailable. And it's not meant to be. Like when you think about it, there's a book called Sapiens, written by a guy named Harari, New York Times bestseller. He said, you and I are more like cavemen and cavewomen than we know. The Homo sapiens have been on the planet up to about 400,000 years ago. Before 10,000 years ago, we were just hunter-gatherers. Basically, we just stood around and ate raw vegetables all the time. So for hundreds of thousands of years, we ate food that wasn't even cooked, but we spent 18 hours a day eating raw weeds and herbs and leaves. Some of us got poisoned and went, hey, we shouldn't eat what that guy ate, and they no longer eat poison ivy, or they eat other things. They burn something and then they smoke and go, oh, we like that. So we're very primitive. So our bodies love whole foods. Processed foods have only been around for probably the last 80 years. So our bodies recognize apple. It recognizes potato. It recognizes spinach. Vegetables with no ingredients except one is what our bodies love most. And our bacteria, and this is really where it gets kind of interesting, because the National Institute of Health in Bethesda, Maryland, in 2012, only thought we had 2,000 species of bacteria inside us. These bacteria have been on the planet for how long? 4 billion years. So these bacteria, which were here before the dinosaur, long after the dinosaur, these bacteria have an intimate knowledge with whole foods. All they know is foods with one ingredient on. So anytime we eat whole foods, we hack into this wisdom of our bacteria. And bacteria don't have a brain, but they have a consciousness. And they know when you're eating processed food. They know when you're putting junk food down. They know when you're putting food with all these ingredients on, preservatives inside. Bacteria hate preservatives. Bacteria hate pesticides and herbicides and fungicides. So the more junk you're eating, the more chance you're telling your bacteria, it's a crazy world. And now they're not going to make serotonin. 90% of the serotonin that makes you feel connected with people is made in your GI tract. They're not going to make GABA and dopamine. Sure, if the lack of dopamine is Parkinson's, but if you want good brain chemistry, you got to eat food that your bacteria like. Because when they're happy, you get mental clarity. So if we want to succeed, if we want to be more authentic in our communication, you really need to eat well. So nutrition is not just for the bodybuilder or the Miss Fitness universe. Good nutrition is for the business leader. It's good for the mom. It's good for the dad. And whole foods is where this lies. Eating whole foods is the key.
Yeah, that's awesome. Awesome things you're sharing here. Makes so much sense. Now, what about carbs? I mean, people love carbs. I just saw something on Facebook. It was like, oh yeah, carbs is your happy food. It's your comfort food. You should have more of it. And I'm like, makes me feel bad when I eat carbs.
Hey, and that's the definition that people get kind of crazy about, because believe it or not, even meat has some carbohydrate. Even an egg, very little, but even eggs have a carbohydrate. Eggs aren't the demon they think you are. It's processed carbs. It's processed fat, trans fat. It's processed protein, processed meat, like luncheon meats and salami and some of these meats, nitrites inside. That's what's not good for you. So when you think of carbs, think of apples. Spinach is carbohydrate. Sweet potato is carbohydrate. Kale is a carbohydrate. So carbs aren't the demon. Carbs have gotten a bad rap. And I know many people that cut out fruit when they go on a healthy diet, but fruit is not the obese person's problem. Elvis Presley didn't look like that on his last few days on the toilet because of apples and cranberries and grapes. So when I walk into the team room and I'm eating like a big handful of grapes, I'll often get a hygienist say, oh, Dr. Odiatu, that's so much sugar. I'm like, This sugar comes with fiber. It comes with the skin. It comes with the whole natural ingredient that helps my bacteria. And bacteria love fiber. Fiber only comes with carbohydrate. My ancient single-celled organisms, this bacteria that call me home, need fiber. This relationship is foundational. So if someone does low carb, you are starving your bacteria, and now you've invited the devil into your body, and now you're going to have lack of clarity, constipation, low energy. We need carbs. So I am totally fine with carbs. It's processed carbs. So these names get bandied about. I think people get mystified, and you get someone who's got a PhD, you get someone who's a prosthodontist, confused at the nomenclature, and even nutritionists are confused. You'll get 10 experts online arguing over some fringe topic. And I believe in foundational principles. I think the best coaches like yourself, the best consultants, you talk about foundation, getting to know someone, telling the human story, treating people like they're important. But so many experts go into this esoteric fringe area, which is confusing and mystified. I like talking about foundational principles, like the best coaches, Pat Riley and John Madden. So I think foundational nutrition is easy, but it doesn't make a lot of money on Instagram. So they talk about this odd hydrogen-infused water. Most people walk around dehydrated. I can smell a dehydrated patient from an operatory away. So don't confuse it with hydrogen water. Oh, I bought a machine that hydrogenates water. You know what? My patient's not even drinking water. I can smell a person who's dehydrated. Their mouth is dry. They got geographic tongue. They got angiocheilitis. They got chapped lips. That is not good on itself. So we confuse them with hydrogen-infused water machine. Now they're confused. Oh, I can't afford that. I'm a hygienist. Hey, let's talk drinking tap water is your friend.
Great. That's great. All good stuff. I'm telling you. And then another thing is you hear people like, I had a friend say, oh, carrots are full of carbs. Aren't carrots good for you?
Yeah, full of vitamin A, full of fiber. You have all kinds, you have beta carotene inside. And the one thing I'd really like to make clear, and I guess obviously people got I'm sure people have already taken away some good stuff from here. This is not just for athletes. This is for the high functioning mom, dad, business person, single mom, single dad. But again, we demonize some food and we call the acai berry the hero, or spirulina, or you got to have moringa. You know what? Uche talks about avocado. I hate avocado. Am I doomed? Okay, you can't have avocado. Nuts have fiber. Apples have fiber. Salads have fiber. So there is no demon food. If someone's sleeping well, if you love your job, you have a good family relationship, and you exercise, you can have that glass of wine every night. I wouldn't have it right before bed, but you can enjoy a glass of wine every night and still look incredible. But if someone doesn't sleep well, doesn't have a supportive spouse, doesn't like their job, sedentary living, sitting all day at reception, that glass of wine will be your Achilles heel. So you can enjoy the decadence if the rest of your life is in order. But I wouldn't have a glass of wine every night if I have a sedentary life, hate my job, don't have a good significant other, I don't sleep well, and I have a BMI over 30. But you can have a glass of wine every night if all the other things are in place. So there's no all or nothing rules. And I think a lot of smart people intellectualize all this stuff and they overthink it. And overthinking doesn't help anything. It doesn't help anything. So overthinking nutrition makes it complicated. Now, so I'm glad you brought that up about the carrots for sure.
Yeah. Well, good. So what would be like, I want to know what you eat. Like, I want to know what's on your plate. Tell me what you had today so far, or last night for dinner.
So last night, believe it or not, people think scrambled eggs are for breakfast. I don't even make a nice omelet. It's funny because I'm doing a cooking demonstration for the American Academy of Pediatric Dentists in Toronto at the end of May. And I'm not even a good cook. I have friends that make fun of me. They go, Uche, I see you stirring stuff online. He goes, you don't know how to, I said, I don't know how to cook, but I do get excited about my ingredients. I'm like Jamie Oliver with my ingredients. I'm like the Hell's Kitchen guy.
Okay.
I get excited about my ingredients. So I give example. So I had this about 10:30 last night. Again, a non-stick pan, but again, not with the usual Teflon, with another kind of special protective pan. I put coconut oil in, coconut fat as my non-stick ingredient. I cooked in avocado oil, which is a polyunsaturated fat. I put black pepper. I put sea salt. I put some turmeric powder. Again, I'd rather have turmeric, but I didn't have any. I put some turmeric powder in. I threw some spinach on, stirred it up, heated that up. I chopped up some mushrooms, put that in, chopped up a red pepper, put that in, let it kind of simmer and stew together. That alone, anytime you have onions, I cooked actually a red onion, not necessarily the classic cooking onion, but a red onion. Anytime you have onion, oil, turmeric, and black pepper cooked in oil, it increases the absorption of some of these nutrients. You get by that, how much? by 1,000%, 1,000%. So as I get older, our digestive power goes down. So the 80-year-old man or woman that eats a hamburger compared to the 14-year-old guy that eats a hamburger, our digestive juices aren't as strong. So as we get older, we need to cook with foods that increase the absorption of nutrients. So the reason why, as we get older, the body tends to have entropy is because even though they might be eating, they're not absorbing. Because the doctor will often say, "What are you eating, Sandy?" And you'll say, "I'm not sure why your meniscus is not getting better. You're eating all the right things. But Sandy, are you digesting and absorbing it? Do you have the bacteria to break it down?" There's about 30 human enzymes in the body that digest food, but there's up to 10,000 bacterial enzymes. So if your beneficial flora is disrupted by too much antibiotics, stress, not eating that fiber, you could put good food in, but it's not going into your meniscus to heal. And that's what happens. It's like me when I go to a meeting planner. I went to Vancouver last year. If they paid me in Russian rubles, guess what? They can give me $10,000 in Russian rubles. I can't exchange it. It's useless to me. A lot of people are eating food, but it's useless because they don't have the digestive enzymes. So you want to increase the absorption. So one way to do that is cook with good fats. Coconut oil, which is saturated fat. It's not bad. Avocado oil. You put black pepper. You put sea salt. You put some onions in. And now that increased the absorption of the other nutrients up to 1,000%. And this is the secret sauce of the over 55 crowd. If you want to have smooth skin, a knee that doesn't click when you walk, if you want mental clarity, okay, I'm touching all the hot topics for anyone over 50. You don't want knees. If you walk down the dental office and your knees are clicking, or you reach down to get something that falls and you go, "Ugh," and you stand up and go, "Ugh," your team's going, "Hey, when are you retiring?" So these baby boomers don't want to let go. Mick Jagger and the Rolling Stones are going on their 30th tour. He's 80. He's 80 with a 3-year-old. You don't see him grunting if the microphone drops. You don't see him holding his back going, "I can't get no satisfaction." He is on fire. I saw him practicing his moves on YouTube, like a recent video. He was moving like a 14-year-old. You can only do that if you're eating impeccably. But let me get back to my story. I know I went up a little window there. So I have all those spices. I have herb. I have spinach. I'll throw in the red pepper. Now I put eggs in. I love free-range organic eggs. If you're going to eat the ovum of another thing, I'd rather have it be organic. So when I eat meat, I love going to that special little section, and it's around the other section, raised without hormones and raised without antibiotics, because antibiotics disrupt our biome. So all the major stores now sell better quality meat. Okay, if you can't afford it, still eat the regular meat. But if you have a chronic injury, you're afraid of dementia, you're afraid of your body breaking down, I would say, don't just buy food. And it's the way of looking at it differently. It's called an investment. I'm investing. When people say, "Oh, the groceries cost a lot." No, this is my investment, because this grocery cart is going to become my knee. It's going to become my back. This is my hair. And it's a different way of looking at food as an investment versus a cost. So my grocery bill is not a cost. It's an investment in me. It becomes who I am. Like I'm literally,
I love that.
as I'm with you now, I am the culmination of the last year of food. This is broccoli. This is the kale. This is my free-range organic eggs. If I ate junk food and processed food, I would be a different Uche with a different level of energy talking to you today. And I like to be a living embodiment of my grocery list. So that was what I ate last night. But if you literally followed me around, I do certain things a certain way, which I take for granted because I'm like Stephen Covey. It's called unconscious competence. There's 4 levels, right? Unconscious incompetence, conscious incompetence, conscious competence, where a lot of dentists and business people are constantly trying to be better. They got the Oura ring, they got the Fitbit. It takes energy to count carbs. It takes energy to have a fiber app. It takes energy to have a trainer for your upper body. It takes energy to have all these coaches. Where you probably really want to get your clients and your people to is unconscious competence, where you do things naturally. It's part of your habitual daily habits. You want to be the Richard Branson of dentistry. You want to be the Richard Branson if you own that store. You want to be the kind of mom that's like Richard Branson. You just make everyone feel good about you. And you can only do that if you're eating healthy and investing in nutrients, which help support that kind of physiology and support that kind of mental clarity.
It makes sense. This is awesome. I can't wait to go to Whole Foods. So I've already been buying a lot of the red bell pepper, the yellow and green, and we grow green. We have a garden. We have a garden with cucumbers and tomatoes and cabbage, and
we're living it
right in the back, and blueberries and blackberries. So we have a lot of things going, and we've eaten so much healthier without really being on a diet over the last year. My husband's dropped over 30 pounds, and I've lost 23
Wow.
over not really dieting, just kind of really you motivated me that last time. It's been about 18 months ago at ADMC, and I'm telling you that breakfast. Now, my next question is, how many eggs can we eat a week?
You know what? They said if you're an active person with no chronic conditions, eggs may not be your problem, unless you have a certain gene. I think it's ApoB, certain gene that makes you have higher cholesterol that you have to have a problem. But eggs, a lot of strength athletes, a lot of athletes, 3, 4, 5 a day. Most people may not want to have a dozen every 2 days.
My cholesterol was okay. All my blood work was great. So
I'm not afraid of eggs. Eggs is the reason why we compare. We always say eggs have a biological value of 100. So we compare the goodness of athletic protein powder, whey protein, to an egg. So if egg is the gold standard, it's like your Gordon Christensen. It's like your course of depth of your postdoctorate training. Like, so if we compare, if egg is your gold standard, then hey, eggs are fine. And again, according to taste. If you never ate an egg, no big deal. There's other kinds of protein. But it's just so easy, Again, I would try and buy free-range organic if you can. But regular eggs, good protein. I remember in grade 12, to give an example, when I was in my peak of my weight training, I would eat up to 10 a day. And one time I estimated in a year, I had 3,650 eggs. I had my cholesterol tested at 21, so Mom was like really worried. My cholesterol was low normal. So she goes, my son in the last 3 years has eaten almost 10,000 eggs. He goes, it's not showing up in his body. So either I don't have that gene, or my body was processing it well, or that placebo effect. I think when I eat I eat very mindfully. I eat with intention. So if I had green tea, I don't just choke it back. I'm thinking, wow, EGCG, epigallocatechin gallate. It encourages cancer cells to go home. So I sip my green tea with intention. Now they've actually shown if you eat with intention, you actually get more nutrition out of it. There was a Yale study that had 2 groups, and they were both fed the same smoothie. One group was told it was a decadent smoothie, lots of sugar. Another group was told that it was really good for you, had avocado in it. So they're both fed the same. They were both fed the same smoothie. Well, when they had a continuous glucose monitor on both of them. The group that felt they were eating a decadent smoothie, their blood sugar spiked and their pancreas started pumping out insulin to show you the power of the mind. If I think I'm eating something bad, and it could actually have good stuff inside, my body responds, the blood work, the river of life, your blood sugar responds as if I'm poisoning in it. So people feel guilty eating fries. It's even worse for you. If you have mixed emotions about food or of anything, part of the Mediterranean diet is just eating with good conversation. They don't talk about religion, drugs, and politics around the dinner table. That's one of the hallmarks of the Mediterranean diet. Don't talk about the next election. Talk about your dreams and goals. What did you learn today? Now you'll have better digestion. So that whole concept of eating with intention is one of my secrets, how I can even eat a food that's labeled not so good and still have a flat stomach in my 50s and still be lean, still have this huge bicep. And I'm not an athlete. But I have an arm like Tom Brady. How is that possible when I don't work out 3 hours a day? I do things throughout my day and I do certain things unconsciously. And that's my desire to demystify all this and share with business people, dentists, the whole team, how you can enjoy an ageless body, a timeless mind by eating, sleeping, breathing a certain way. And I thought this was my mom and dad, planted the seed at age 6, 8, 7, and 8 in England, but they were both really shy people, never been to university. But my mom, she's Irish, so she gave me the gift of the gab. Right? She, born in Bray, raised in Dublin, she gave me that gift of storytelling. And my dad gave me the power of intention. He goes, Uche, you've studied enough. Go outside and play. Nigerian, So I got this neat style of sharing stories and look at the science. But
you just helped so many people.
Yeah, and I enjoy it. I share from the heart with people I care about, and I care about everyone. I care about everyone.
I mean, I've just over the years following you and then seeing you in person and seeing the reactions of people after you've been on stage, it's tremendous. And it has definitely touched me and my family. And I've shared it with friends and now with all of our listeners on Dental Drill Bit. So I was really excited to have you on today. Is there any other thing that you'd like to share with the listeners?
My whole goal is when I talk to anyone or an audience, even you and I this morning, I don't want you to think I'm amazing as much as I want you to think of the human body as amazing. I want you to think that you're amazing. I want you to have developed reverence for this beautiful body that Sandy is currently using and treat it like a high performance Formula One race car, premium fuel, investing in premium tools to be able to continue on your message of consulting and advising and writing and speaking.
Right.
So it's not me. Like, I'm just a selfless vehicle. This information is passing through me from my mom and dad or the books I read. I really want to make audiences feel, and I really get this, people leave elevated. I want them to feel, oh my God, I get it. That's the sense I want. So I'm emceeing, which state are you in, Sandy? Which
Louisiana, down here,
Louisiana.
near New
Okay.
Orleans. Yeah.
Okay. So one of the things I'm doing, I'm emceeing. I'm doing one little session for, it's called Bulletproof Summit. Is it called the Bulletproof Summit in June? So I'm going to be emceeing their whole 2-day program. I'm also doing a session.
Energy Plus.
Energy Plus. I can get a little edgy, a little bit of Ricky Gervais. I was born in England, a little bit of Kevin Hart. Okay, so it's going to be funny. But I think I want to share the depth of Hippocrates. So it's called Bulletproof Summit. I'm really fond of these two guys that started that. But I'm also, I'm glad I'm sharing today. I'm in the office 3 days a week. I share with patients. I live this stuff. I got more to learn. I never stop downloading books. I love it. This is, it's a neat life. And, with 4 little kids looking to me saying, Dad, you make work fun. Because a lot of people come home from work, they pour themselves a double scotch. They say to mom or dad, don't disturb mom until she's had a scotch to take the edge off. So now the kids think life is tough. Work is a chore. You got to take the edge off. So I'll never come home looking like work beat me up. I will only share the good stories. I share good stories. I brought my oldest daughter with me for 3 or 4 lectures over the last 5 years. She goes, Dad, I can't believe people listen to you. She goes, these are the same stories you tell us. I said,
That's funny.
I said, you can actually earn a living doing what you love and helping people. She goes, Dad, this is so cool. But you know what? She's 12. She goes, you need more business cards. She goes, when people ask you for your card, you always say you don't have any. So here's my 12-year-old giving me tips.
Great.
And I'm like, good idea. Good on you, little Kylie.
Well, this was wonderful. And I know the listeners are going to enjoy this. For me, I'm going to listen to it several more times and take more notes because I love how you put things. That helps me explain to other people too, because it's insane how little people know about eating right.
Yeah.
It's just insane when you listen. It's kind of like dentistry. When people start talking about, well, I haven't been to the dentist in 10 years, but nothing's hurting. It's like, what?
Yeah. No, I think the ability to make a complicated subject easy is like Einstein said, talk to people, not necessarily at a grade 2 level, but make a complicated subject easy is the mark of genius. I know really smart people, if they're not good at making what they do sound easy, they don't really know it. It's they've memorized it. But that ability to make a complicated subject easy and to let people know when you share something you just learned like you're doing, if you share a new concept, every time you share something with someone, your brain goes deeper into understanding it. And the retention now goes up to 90%. So neuroplasticity happens, not just when you listen, but when you now share it or text, oh my God, I just heard Sandy and Uche talk about this. And you share something about mushrooms, now that will stay with you forever. You will never pass by a counter with mushrooms ever the same again. And that's permanent learning. That's youth. That's neuroplasticity. So you've just articulated to be able to discuss a complicated subject at an easy level where a layperson now understands it is the true gift of understanding. And now you truly know it when you can explain it in a way that you'll go, oh, hey, I get that. And that's the gift that you have. And I'm learning. And I think that's what we want to share with these dentists and other business people, like to be able to explain a complicated subject in a way that's non-judgmental, but making people feel empowered. Like, oh my God, I want to get that done. Oh my God, I need to come in every 3 months for hygiene to lower my inflammatory burden. I need to get my husband sleeping quieter. Otherwise, he's suffering episodic hypoxia, which is supporting dementia. And that ability in a non-judgmental way is the true gift of a good consultant, and this is what you and I do. This is what we do, So I appreciate you sharing me with your listeners or viewers. This has been a really nice time.
Yeah, definitely. And again, I'm excited. I got to get cooking, get a healthy thing.
Yes.
So thank you, Uche, and best wishes to you in your travels and sharing with all the wonderful dental folks.
Yeah, my pleasure.